Hi, in this episode we'll be discussing psoriasis. Psoriasis is a common chronic inflammatory skin condition characterized by raised, red, itchy, scaly plaques on the skin. Psoriasis lesions can appear on any part of the skin, however the scalp and the extensive surfaces of the knees and elbows are commonly affected. Psoriatic lesions are often itchy, and in more severe cases can lead to lichenification of the skin. Lichenification is where the skin becomes leathery. With treatment, psoriasis often follows a relapsing remitting course, although in more severe cases it may never fully go into remission. Pathologically, it's caused by an abnormal immune response to the skin, causing inflammation of the skin, leading to redness. The abnormal immune response also speeds up the production of skin cells. This is known as hyperkeratosis. This therefore leads to the formation of silver scaly plaques. The exact cause of this is unknown. However, it's thought that your genetics as well as environmental factors play a role in developing the disease. There are many different types of psoriasis, some more common than others. Four main types of psoriasis are plaque psoriasis, guttate psoriasis, flexural psoriasis, as well as pustular psoriasis. Plaque psoriasis is the most common type of psoriasis, accounting for 90% of psoriasis cases. It's characterized by the classic well-defined red plaques with silver scaling. The lesions are most commonly found on the extensor surfaces of the elbows and knees, and are typically itchy, and may even be painful in some patients. Guttate psoriasis typically occurs a couple of weeks after a streptococcal throat infection. It presents as lots of small red plaques affecting the trunk. Guttate psoriasis usually resolves on its own after a few weeks. Flexural psoriasis, also known as inverse psoriasis, causes red plaques that are not scaly and affects the skin folds, such as the armpits and the groin area. The lesions are usually smooth, unlike the classic plaque psoriasis, which is more rough to touch. Pustular psoriasis is a rare, serious form of psoriasis that may require emergency treatment. It's characterized by white pustules that develop very quickly over a wide area of skin. It typically causes patients to become systemically unwell with fever and generalized malaise. Psoriasis can be associated with other conditions. One example is psoriatic arthritis. Psoriatic arthritis is a chronic, seronegative inflammatory arthritis that affects around a third of patients with psoriasis. It causes classical inflammatory arthritis symptoms such as joint pain, swelling, and stiffness. Psoriasis can also be associated with other conditions such as psoriatic nail disease. Psoriatic nail disease can cause a number of features such as pitting, where tiny dents develop in the nails, thickening of the nails, onycholysis, which is by the separation of the nail from the nail bed, ridging, where vertical or horizontal ridges develop on the nails, as well as discoloration, typically to a yellow or brown color. Psoriasis is a chronic condition, and although no cure exists, treatments can be effective at reducing the disease and even putting the disease into remission. There are a number of types of psoriasis, each with its own treatment pathway. However, we will focus on the treatment of the most common form of psoriasis, which is plaque psoriasis. Topical agents are typically offered first line for plaque psoriasis. Phototherapy and systemic therapies are generally used second or third line, but may be started earlier in those with severe disease or extensive disease, where topical agents are ineffective. There are a variety of topical therapies that can be used. The choice depends on the severity of the disease as well as patient factors and side effects of the agents. Emollients are moisturizing agents that help reduce itching and remove scaling. Topical steroids have an anti-inflammatory effect and may be used for limited courses. A wide range of different strengths of steroids are available, and the correct form must be chosen depending on the site and severity of the disease. Topical vitamin D analogues such as calcipotriol work by dampening down the immune response as well as reducing the growth of skin cells, therefore reducing plaque formation. Phototherapy is used as second line or third line therapy in those that don't respond to first line topical treatments. It involves exposing the skin to ultraviolet light under controlled conditions. This helps slow down the excessive growth of skin cells. It also has anti-inflammatory effects and therefore helps reduce redness, swelling, and itching. The use of systemic therapies has to be weighed against their potentially severe side effects. They are therefore typically only started by specialist doctors. Methotrexate is an antifolate immunosuppressant normally used first line in patients requiring systemic therapy. It works by reducing the hyperproliferation of skin cells. However, it is highly teratogenic and therefore can't be used during pregnancy or in those breastfeeding. Contraception is advised for both men and women during and for at least 6 months after treatment. Cyclosporin is a calcineurin inhibitor with immunosuppressant action. It is often used by rapid control as needed, such as a severe acute flare-up. It can also be used in pregnancy, unlike methotrexate. Acitretin is a retinoid, and its use is restricted, and generally only used in those who have failed other systemic options.